We've been talking a lot about cases of West Nile in North Texas this summer, and as of this week, CDC data shows Texas has more cases than any other state. Now, we know the disease is spread by mosquitoes and can cause serious illness for some people. Our medical expert, Dr. David Winter with the Baylor Scott & White, is here with what you need to know at this point. Good to see you again.
Good to see you, Kara. Good to be with you.
Okay, why are we seeing more cases of West Nile, and how contagious is it?
Yeah, it's those pesky mosquitoes. We had kind of a wet summer, and when there's standing water around, mosquitoes proliferate. They're the ones who spread this from birds, where it lives naturally, to humans. Now, fortunately, humans don't spread it to humans. We're not sure exactly why that is, but there's still a fair number of people out there. Most cases, in fact, are mild, but some can be very severe. Dr. Anthony Fauci hospitalized last week. Fortunately, he's recovering, but in fact, most cases actually are mild, Kara.
Okay, so let's talk about some of those symptoms of West Nile virus, I guess, for mild and more severe cases.
Yeah, so most folks will have a headache, muscle aches, joint aches, a little bit of fatigue. Usually goes away in 3 to 5 days, so not bad. But 1 out of 50 gets the severe cases. It gets up in the brain, causing memory loss, confusion, brain fog. Actually, some people get into a coma, and some of them even die with that. You diagnose it with a blood test or with a spinal tap, and when it's positive, if you have a severe case, you need to get into a hospital.
Now, when you diagnose this with that blood test, how do you treat it?
Yeah, that's the problem, Kara. There's no specific treatments. Antibiotics don't work for this. So the best thing is prevention. We know that mosquitoes are most active early morning hours, late evening hours. So if you're out at those times, if you're outdoors, it makes sense to wear long sleeves, long pants, and use plenty of insect repellent. Because otherwise, those mosquitoes, some of those are spreading this West Nile virus right now.
Okay, this is kind of a two-parter, but I've always wondered, where did the name come from? And if you do get sick with it, can it come back? Can it affect anyone, or are you immune to it afterwards?
Yeah, the name came from when it was first diagnosed a long time ago, in 1937, in the West Nile riverbank in Africa, the town or the country of Uganda. And it's still, most of them are over there. And so we have a lot of information from there. And we found out that if you get West Nile virus and recover, you don't get it again. You build up antibodies. So that's one, I guess, positive thing about it. You get lifelong immunity, but you don't want to get it in the first place. So beware of those mosquitoes when you're outdoors.
Yeah, that is a good point. All right. Thank you, Dr. Winter. We'll see you next week.
All right. Good to be with you.